Hey, this is Jazz with Columbia Family Chiropractic. I'm the licensed massage therapist. I've been licensed since 2015. Been doing massage really since 2012. This is what I love to do. This is a huge passion of mine. I fell in love with massage therapy several years ago when I was actually learning mixed martial arts. And we had an amazing massage therapist who could really treat a lot of the injuries for the team very easily, just with manual therapy, and I was hooked after that. So I wanted to learn it. I went to school for it, and of course I went in to learn how to treat injuries and how to help athletes for performance. But in doing that, you also learn a lot of common injuries that occur among our everyday population. You know, stiff back, neck, TMJD issues. You've got sciatica, these type of things we see all the time. And these are things I love to treat because it's so treatable with your hands. And even at home, you can do these things easily. And I like being able to take that therapy into my own hands and not have to rely on anybody outside of that, not having to rely on the medicine to do that. It's really powerful, and I'm glad to be a part of it. So one of my favorite things about working at Columbia Family Chiropractic is the personalization of the experience. I've worked before in places where it was an open bay area. You're massaging, but you're also doing 10 other things. Here, massage is all done in one room. It's just you and the patient, and you get to really identify those problems head on, spend a lot of time noticing the problem and working on it, and also hearing about their day. We really do care about how our patients are feeling and what's going on in their lives. So it gives me some one-on-one time with that patient and allows me to get to know them a bit better. So I really appreciate that about this experience. All right, so this patient today has come to me with complaints of low back pain. So when I get a complaint of low back pain, I wanna look at the whole posterior backside, basically. All right, so what we wanna look at first is the erector spinae. So what keeps the spine upright, okay? The second thing we want to look at is this very large muscle back here, the quadratus lumborum, okay? Because when either of these is shortened, they can pull on the spine and really upset the low back, okay? So once I get through the spinal erectors here, I'm gonna make sure that we even them out. We petrissage our way in to loosen it up, okay? And then I'm gonna look in the opposite direction at the quadratus lumborum, okay? And we wanna keep this nice and open. This also has a lot to do with our lateral flexion. So basically when we go side to side. Now women especially are pretty prone to discomfort here because of a sway back, a kind of a large curve in the lumbar spine. So we want to even this out, okay? Now one of the techniques I do from here is push on the sacrum. All right, and I'm gonna have this patient tilt her pelvis towards the table. Good, and relax. Push again, and relax. And one more time, and relax. Good, and we've already evened her out just a little bit to take some of the pressure off of that low back. All right, now as we move a little bit further down, we've got a lot of tightness here in the glutes. This is probably caused from the amount of running that this patient does, which will commonly affect the glutes and hamstrings. So here and here. All right, so when you're doing low back, you always wanna make sure that you touch on the hip rotators, okay? So basically how we're able to open and close the hip. We wanna make sure that these are healthy. Okay? So once we've loosened that up, probably put an elbow in gently, follow the breath down, have her take a deep breath in, and exhale. Good. And again, exhale. And one more, and exhale. All right, so we're gonna pick this one up. One elbow in. Okay, we're gonna go laterally and then medially. Okay, and this is is a good gauge to see where her hip rotation is and how good her range is right now. If there's any kind of shortness here, we want to treat the muscles that are responsible for that. So this is our main lateral rotator. This is our main medial rotator. Push it in. Good. And her range is already getting better, okay? Now, in case that she's still a bit tight, you want to work your way down the leg, okay? Because there's a lot of involvement also with the low back to the abductors. Sorry, the adductors. All right. These are going to bring the hip in, okay? Still a good bit of tightness here, and you can just massage this way out. This is an easy one you can do at home. Okay. Good. All right, have her relax in case there's any bit of tension there. Flex the knee, bring it down, work our way down the calf. Okay. Pick it up, massage it out, and then massage that Achilles tendon with a little bit of cross friction here, cross fiber friction. Okay, and close out. We're gonna give it a good shake, set it down, and then start on the other side. So a lot of the things I see here are people who work at a desk, computer, typically have a lot of pain in their head and neck region, okay? Especially in the shoulders. So what we're going to do here is kind of identify some of that tightness that might occur in the shoulders. The two big muscles I like to look at for this would be the trapezius, okay? It's a very large muscle, but we're just going to look at the top part of it that's closer to the shoulder, okay? And the levator scapula. I'll get into those terms a little later. All right, so with the traps, what we're going to do here is identify the first two that are closest to the shoulder, okay? The first two muscle fibers of it, okay? And once we open this up, this makes it much easier for us to go down the shoulder. There we go. And kind of get her range back, get that blood flowing and elongate the muscle, okay? Once we've tackled that one, we're going to go back towards the corner of where the neck meets the shoulder and find that levator scapula. It's a very small muscle that kind of helps elevate the shoulders. Pull it up, pinch, and hopefully if you're lucky we get a release there. Some people have very, very tight situations here. Now, no matter whether you have a release or not, you gotta apply that pressure to an adequate degree, just so that we know that this is getting worked on. If this is not treated, this can lead to bad headaches, facial pain, stress, and general discomfort. We don't want to have that in our working day, so we want to address that head on. Okay, all right, and I'm going to have her turn over next. Yep, so flip over for me. And yep, let's go down just a tad, that way. Good, all right. And then here, another way to identify that is to pick it up here, pull, and rotate. Now this is going to add a lot of range to that levator scapula. Okay, that's going to open it up nice and easy. Okay, we're going to identify that on the other side. 2, 5. Good. Now remember, these muscles are very big players in headache pain. So we want to make sure that these are treated if somebody comes in with complaints of headaches, head or neck pain. Okay. So another thing we see quite often here at the office is jaw pain. Okay, now this can come in the form of TMJD. This can be clenching. This can be headaches, stress, shoulder discomfort. All of these kind of fall under that umbrella. So we do want to identify this by massaging the face and get into the jaw as well. All right. So something that I like to look at when somebody presents issues with this is to have them slowly open the jaw and identify which side is a bit shorter. Okay, now on this side, this is the shorter side, so we're gonna massage it out with our thumb, and then once we get some length there, we can start moving on to the neck and shoulders to see where there might be some additional shortness of muscles, okay? For the more aggressive situations, if you've got very bad pain there, if it's bothering you on a daily basis, we're probably going to take it up another step and add a little bit of elbow into that. I know that sounds like a lot, but it's really therapeutic. We just want to make sure that we're identifying all the factors that could be contributing to that pain in the head and neck. So there are two cases that I really remember where people had some severe jaw pain. One was a younger girl, Kate. She had a very stressful job, kind of her first full-time job, and was often clenching her teeth. And it was really causing her some discomfort, some headache, shoulder tension, and a real inability to relax. So what we did was we had her leg face up like this, and we did a lot of that same jaw movement where we have her open up and then slowly work our way down the sides of the masseter, of this big muscle here. Okay, and just a little bit of that with some added head and neck flexion and shoulder massage really helped ease that. It was about a 6-week course that we did with her, and week by week we saw a little bit of diminishing of the pain. Okay, the next case I remember was a patient, Maria, who had been in a car accident. In her x-ray, her jaw was off to the side a good bit, and it was causing her these chronic headaches. So of course, with the help of the chiropractors to help readjust the jaw, we also added some massage therapy to realign the jaw as well. And you always want to work around that head and neck. These are all very interrelated. We've got to address all of them together. Lengthen and then realign. And her course was about 2 months long. And again, through seeing her 2 to 3 times a week, we were able to get her back down to where the headaches were not an issue anymore. All right, so we're going to go over a couple of hip stretches today. These are the ones I commonly do with the folks that are sitting at a desk throughout most of the day, the runners, low back patients. If you've got pain in the low back or hips, this is a great one for you, okay? So we're going to do a hip flexor stretch first. All right, so in office, this is how I would do it. I would lay one leg off the table, push the knee down, and then have the rest of the leg back, okay? Now, at home, you can do this by grabbing the ankle, good, and allowing that nice deep stretch here in the hip flexor, okay? Now, it's important not to let the back arch, okay? Once we've done that, we've compromised and we're not really getting the correct stretch. So we want to keep that back flat, and that's going to really open up that hip flexor nice and deep, okay? Now, let's let go of that. The next one we're going to do is a hip rotator, okay? So you're going to feel this here in the back. In office, it will look like this. Now, not only do I want to flex the hip, but I want to rotate the hip. So this is going to involve a little bit of a turn here, all right? So for her to do this at home, she's going to keep this knee bent, then hug the back of that hamstring, very good, and then keep those hips open. That's going to give her that nice deep stretch, okay? Both of these are great to do for about 20 to 30 seconds each side. Repeat if necessary, but you should definitely feel that opening of the hips once you've done it.